Pharmac today announced it intends funding immunotherapy drug Opdivo for 350 patients with advanced melanoma from July. The drug buying agency ruled out Keytruda in favour of Opdivo, which can also be used to treat lung cancer patients. I think it's also been approved for that in Australia. It does come just 48 hours after Australia announced it would subsidise Opdivo as well as Keytruda, which is already subsidised and available to melanoma patients there. Now, earlier in Checkpoint tonight, we spoke with advanced melanoma patient Lisa Renwick, who led the petition to Parliament in March calling for an immunotherapy drug to be funded. Kathryn Williams is another melanoma patient who helped with that petition. Kathryn was diagnosed with advanced melanoma in 2007. But after her diagnosis, she was granted compassionate case access to a vaccine by the Malaghan Institute. She's since been a patient advocate, and she joins me now from our Wellington studio. Kathryn, it's lovely to have you with me. Can you see me, by the way? I can see you. Can you see me? No. There's a stupid cutout picture of me there, isn't there?
There is.
Okay,
but
well,
I'm fine.
Okay, well, it's lovely to have you with us. How are you feeling today?
Oh, John, it's been a big day, a huge day. This is the first response for melanoma cancer patients in my time of being diagnosed. So I was diagnosed in 2008. So this is the first time in 7 years that New Zealand government have responded, and the news was overwhelming today. Pretty emotional, pretty bittersweet for many families, many of our New Zealand families, but I think we need to be mindful that it's a great day. It's a great day for melanoma in New Zealand. Sorry, John.
No, I can understand this. And
Sorry.
You've got nothing to apologise for. It's an entirely human response. And you're live on the radio talking about something which is literally life and death. And in your case, it's been life. And I think that everyone can understand why you might be feeling, pretty intensely about this. I think we need to contextualise. You were told you didn't have long to live. You were given compassionate access to a radical new form of immunotherapy, and you are still alive in defiance of all the odds. In the meantime, other people have not had access to immunotherapy drugs, and they have been dying. And that is the very real circumstance you find yourself in, isn't it?
Absolutely. Today was very surreal, hugely surreal for me, and I know for a handful of other patients who are still alive today. I was diagnosed 7 years ago, and you're right, John, I had access to immunotherapy, and I've always been an advocate for immunotherapy. It makes sense. It backs your immune system to do the job it was designed to do, and in this case, just to fend off the cancer. And I really hope through this campaign that it's raised awareness for New Zealanders, one, to understand that metastatic melanoma kills you, and up until today we had no effective response for it. And second of all, to understand that, for cancer patients to have had to become involved in this has been really taxing. And today I'd just like people to remember those that we weren't able to get to.
It's so big, isn't it? And also, people circle the wagons around Pharmac, and Pharmac's independence has to be protected. And Pharmac only works if it's able to do its job as dispassionately as humanly possible. But as country after country was funding immunotherapy, as Australia funded 2 immunotherapy drugs, Keytruda and Opdivo, and their rate of melanoma is now lower than ours, and as our sole form of treatment for metastasised melanoma was chemotherapy, which Pharmac itself admits is practically useless, it did become galling, didn't it, for people with metastasised melanoma to sort of wait and wait and wait.
Absolutely, John. And I'm astounded at how well our melanoma patients have behaved through this whole debacle, and it has been a debacle. I'm certainly not happy with what our patients were subjected to, and I'm pleased. But my personal campaign will finish on the 1st of July. I don't know, John. It's been a really, really tough time. I spoke to you on Friday, and it was really, really intense.
Yeah.
I think New Zealanders are to be commended. I think our media are to be commended for backing us, for listening to us. I think our communities are to be commended for taking what we were saying to be true and correct. I think sometimes people think, oh, well, it surely can't be that bad. I'm sure the government would do something about it. The reality is our government didn't do something about it. They have stepped up today. I'm really pleased with that, and it's a good result.
Kathryn Williams, who is a melanoma patient who kind of led the way with immunotherapy. Thank you, Kathryn. Thank you for joining us.